Paste bottle feeding is a way of feeding your baby with a bottle that helps them regulate how much milk they're taking, and it also can be a more similar experience to a breastfeed. There's some points here that of difference in what we may have seen when a baby feeds from a bottle. In paste bottle feeding, we're sitting the baby up. They're really nice and close to us still, so there's lots of that contact with their baby, but they're in a more of an upright position. And the reason we're looking for this is that then when the bottle is in the baby's mouth, the bottle's more in a horizontal position, so that the baby needs to draw the milk out of the bottle. We know that when the bottle's tilted up here, that milk will just drip out, but we want the baby to take the milk that they need. When we start with the paste bottle feed, if we initiate this reflex, one of the feeding reflexes of the baby, by holding the teat here on their lower jaw, that will initiate the baby to open their mouth out wide. Then as we introduce the teat, we're looking that the teat goes all the way into the baby's mouth, so that this is a narrow neck teat, is what we term them as, and that we're wanting the baby's lips to come right to the very end here. So we initiate that and introduce the bottle. Then as we're feeding, we're holding the bottle horizontal. The milk will just cover the end of the teat there and cover the hole. And the baby, as the baby's sucking, as they take a break, a little pause, we might just tilt the bottle down a little bit. And we're waiting for the baby to show us signs that they're wanting more. And that's when we tilt the bottle back up. And there may be a few cycles like that where we tilt down. So then there will come a time where we tilt down and then the baby's just not looking. They might look in another direction, but they're not showing signs that they're wanting more of this milk. So that's when we can take the bottle away and happy that the baby has had the volume that they need. It can be quite tricky, and that if we've made up a whole bottle that we've spent time to express this milk, and we don't want to waste any. So some sort of practical tips are to perhaps offer smaller volumes to the baby, so that once they finish that volume, they're showing some cues that they're wanting more, that then we can go and add some more milk to the bottle. Paste bottle feeds are another way of providing cued care to our baby. So we're cueing into them and their appetite, and what they're letting us know how much milk they want and how often. So babies that are fed bottles via the paste bottle feeds will have varied volumes throughout the day of different feeds, but we're just cueing into our baby and what they need. Another important feature when we're using paste bottle feeds is that we can really switch sides, and sometimes feed on this side and others this side, and that we're really engaging with our baby through the feed. And it's an enjoyable time and an enjoyable experience with our baby. When we're sitting the baby upright for paste bottle feeds, we still have remembering a feeding position, so that the baby still has their head slightly tilted back in almost a sniffing position. If we find that a baby is sitting too upright and they're falling forward, their chin's really tucked down and it's a difficult position for them to feed in. So we want their head slightly tilted back. When we're introducing the bottle, if we're holding, we're trying to initiate this feeding reflex that a baby has, and if we're holding the teat along the baby's chin, that then once that feeding reflex is turned on, then we're tilting the bottle up slowly and introducing it, and it's, as you can see, it's held in a horizontal position there. So when we're giving paste bottle feeds, we're looking also at the type of teat that we're using, and this is what we call a narrow neck teat. And with this teat, we're looking that the baby has the entire teat in their mouth, so that lips go right up to the edge. And that makes it very similar to what we're looking at breastfeeding, that the baby's just not nipple feeding on the end, that they're taking the entire amount in their mouth, so taking breast tissue as well. So when we're introducing that bottle, then we're holding it here, tilting it up and gently introducing it into the baby's mouth. In this paste bottle feeding position, we're able to really interact with our baby with that eye contact. We can really make this an enjoyable time and really spend those moments getting to know our baby that little bit more.